there are no considerations and there's no mechanism in place to assist with that. And it needs to be so, and people need to be able to understand what this experience is. It's not fun. It's not fun to live in a tent when you don't have any bug spray. Yeah.
More than 24 million people are currently enrolled on an ACA plan. Most of them receive an enhanced subsidy. If the enhanced tax credits expire at the end of this year, healthcare nonprofit KFF estimates that premiums will more than double on average in 2026.
What happens to the millions of homeless in America if the healthcare system they depend on collapses? This isn't a hypothetical. It's a real crisis waiting to unfold if the Affordable Care Act ACA is not renewed. With the government shutdown still fresh in our minds and healthcare subsidies hanging by a thread, we must ask ourselves, will those already living on the streets simply be left to fend for themselves when access to life-saving medical care is no longer a given?
I've met some people who've had some serious medical issues, and their issues have not been able to be addressed because, reason given, they are homeless, and that's wrong.
By the end of 2025, the expanded tax credits of the Affordable Care Act ACA will expire if Congress doesn't step up to extend them. The ACA, or Obamacare as folks still call it, isn't some flashy policy wonk's dream. It's a quiet revolution, handing out lifelines to the forgotten. But here's the rub, my friend. What happens when those subsidies vanish? Premiums could spike 20 to 30% next year, yanking coverage from 4 to 5 million Americans, and hitting the homeless hardest, pushing thousands back into the shadows of untreated HIV, opioid hell, or the slow burn of unmanaged diabetes. On top of that, up to 7.3 million people could lose coverage, and nearly 4.8 million might go uninsured. While others fret over rising premiums, how are the folks living on the streets without a fixed address, often dismissed as already accounted for, supposed to cope? And when society talks about healthcare access, are they even in the conversation?
Marginalization of the homeless, because people think that we are invisible. We are not invisible, but if they treat us that way, then they don't have to see the problem. They don't have to recognize the problem for what it is. And that is a lack of affordable housing.
In fact, studies from the Center on Budget and Policy Priorities just this fall show that it has slashed hospital admissions by up to 55% for folks in permanent supportive housing programs. People who, without it, would be stuck footing emergency room bills 4 times steeper than your average citizen. In the sections ahead, I'll dig into how the shadow of an unextended Affordable Care Act, ACA, will hit the hardest on the homeless and those barely hanging on with housing insecurity, especially in a country that pats itself on the back for equal shots at the American dream. Because here's the plain truth. This isn't just about policy wonks hashing out bills. It's about the raw ache of compassion. This piece will take its time peeling back the layers of that grim what if. If the ACA isn't renewed, how exactly will it gut the lives of the homeless across America? Come along with us as we stare that question down and pause to wonder what we, as a society might yet do to stop homeless in America from slipping even deeper into despair. This article is intended for educational purposes only, aiming to raise awareness and encourage thoughtful discussion on the potential impact of policy changes on vulnerable populations, particularly the homeless in America. The Affordable Care Act has represented a significant shift in how we view healthcare in America. Take, for example, the opioid mess, ripping through 30% of the folks on the streets like a wildfire. The ACA linked them up with truly effective treatment programs, helping to cut relapse rates by a third in expansion states, according to the latest KFF analyses from last spring. What about mental health? Lord, 50% of these folks are wrestling with depression or worse, shadows that dog them from one alley to the next. Now, with subsidies making therapy and meds more accessible, they've got a fighting chance to break free from chronic killers like diabetes or HIV. What does that mean in practice? According to the latest data from the Kaiser Family Foundation, if these subsidies expire, the average annual premium for a subsidized enrollee could double from around $888 in 2024 to 2025 to about $1,904 in 2026. What if we yank that away right now, after all these years of fragile progress? Isn't it the height of folly? No, downright callous for those Washington suits to treat these subsidies like pocket change when they've woven folks back into the fabric of community. And what's more, the Commonwealth Fund figures that healthcare providers could lose over $32 billion in revenue come 2026 if those subsidies get axed. Let's chew on that for a spell. These aren't abstract numbers, they're human lives. Folks who've clung to hope because insurance lets them see a doc when they're under the weather, gets them meds that keep them ticking along healthy, and spares them from going bust after a spell of serious illness. When you slash or gut those subsidies hard, you start choking out that hope. For a hardworking soul scraping by on modest pay, the gap between shelling out $300 a year for insurance and coughing up $1,500 or more is a chasm. Who in their right mind could swallow a hike like that? And what happens when the choice ain't which plan anymore, but can I even swing the cost of any coverage at all? When the insurance premium tax credits under the Affordable Care Act ACA aren't extended, the fallout for homeless folks starts unfolding in deeply alarming ways, and the first of those is a barrier to even the most basic healthcare service. So many people without stable housing already grapple with a laundry list of hurdles. No fixed address, skimpy income, chronic health problems, mental health struggles, or substance abuse, and all too often, support networks that are fractured to pieces. Now, picture this on top of everything else. The very system that makes insurance reachable for low-income Americans just vanishes. For those scraping by on the streets or crashing in shelters, this isn't some small-time hassle. It could spell total loss of coverage. Because health insurance often stands as the critical barrier between the sick and the care they need, the repercussions aren't just about dollars and cents. They're profoundly human. Without it, you put off getting help. And if you put it off, everyday conditions like untreated diabetes, high blood pressure, or infections, rampant in the homeless community, can spiral out of control. One analysis predicts that if the ACA insurance tax credits expire, the average out-of-pocket premium for an individual will surge by 114%. So the question isn't simply will someone get insurance, but more like will someone be able to afford keeping it? How many folks will say no because survival elsewhere demands every last dime from their thin wallet? If we slash or seriously undermine that support, the opposite will happen. Health takes a nosedive, income shrinks, and holding onto or securing housing turns into an even steeper uphill battle. This isn't some abstract notion. A downturn in physical or mental health can accelerate the slide into chronic homelessness. Are we okay with accepting that without ACA's backing, homeless people will fade into even greater invisibility in our healthcare system? And worse, how many lives will slip away quietly as the social safety net gets dismantled piece by piece? In the end, the decision on whether to extend those ACA subsidies isn't just about abstract numbers or legislative squabbles. It's about whether we, as a society, keep tossing a lifeline to those living without a roof, without regular medical care, and without any margin for error. Without that lifeline, the human costs will be real, measurable, and profoundly tragic. If the government shutdown persists and ACA subsidies aren't extended, we face more than just a policy glitch. We face a very real human crisis. Consider this. Without renewal, premiums that were once manageable could double, even more than double, for many Americans. A recent report finds that rising health insurance costs could soar by 114% on average, adding well over $1,000 annually for low and middle income enrollees. For people already teetering on the edge, especially those experiencing homelessness, this kind of jump is catastrophic. Scenario 1, soaring insurance costs and shrinking coverage. First, imagine the people who currently rely on Affordable Care Act subsidies to afford even basic health insurance. If the subsidies vanish, monthly premiums rise sharply. Many will simply say, I can't pay that, and they'll drop out of coverage. Because when you're counting your pennies to cover food, a bus pass, a mattress on the floor, how can you also cover a premium tax credit for health insurance tripled in size? Insurance companies themselves anticipate the fallout. Higher cost burdens, fewer healthy participants, sicker risk pools, and thus even higher costs for the remaining. For someone without a stable home, without a regular income or address, this means less access, more worry about each cough or ache. And when access fades, early signs of illness become emergencies, and preventive care becomes an unaffordable luxury. Scenario 2, losing coverage, increasing ear visits. Second, when people lose coverage, they don't just skip doctor visits, they often delay until it's unbearable. At that point, they end up in emergency rooms, which are costly and chaotic, especially for someone already unsheltered. Hospitals, in turn, anticipate an increase in uncompensated care, upwards of $7.7 billion in extra costs if subsidies expire. Premiums could spike 20 to 30% next year, yanking coverage from 4 to 5 million Americans and hitting the homeless hardest, pushing thousands back into the shadows of untreated HIV, opioid hell, or the slow burn of unmanaged diabetes. For homeless individuals, this is a nightmare scenario. Lost nights of shelter, missed medication refills, untreated mental health, or addiction problems that spiral. Ask yourself, if you were without a home, would you risk skipping dental pain, chest tightness, and infection if you knew the cost might bury you? And when that risk is multiplied across thousands, we're talking about lives cut short, health deteriorated, hope diminished. Solutions. Policy and community must act. Now, there is hope, but only if action comes. On the policy level, Congress must act to extend those enhanced ACA subsidies, ideally making them permanent, so that people at the margins don't lose their anchor of care. Several bills are floating, bipartisan in word, contested in practice. At the community level, we, nonprofits, local governments, faith groups, must prepare contingency plans, mobile clinics, low-cost coverage navigators, outreach to the homeless, aggressive efforts to enroll them before coverage gaps widen. Because if we wait until the crisis deepens, the human cost will be irrevocable. And please don't assume someone else will deal with it. The rising healthcare costs and increasing number of uninsured people will affect all of us. They drive up costs, lower health outcomes, erode our social fabric. If we let people slip through the cracks now, we're setting ourselves up for worse divisions, deeper suffering. So I'll ask again, are we prepared to let thousands more fall ill, lose housing, or die because of a policy stalemate? And will we accept that being homeless in America means being invisible to healthcare when you're the most in need? If we choose to act boldly, compassionately, collaboratively, we can mitigate the worst. But if we don't, the choice to let ACA subsidies lapse could echo as one of the gravest injustices of our time. We must act now with a sense of urgency and deep compassion. Because if the enhanced tax credits under the Affordable Care Act are allowed to expire, the consequences won't simply be statistics, they will be real lives unraveling on our streets, lives that could have been saved. Policymakers in Washington face a clear choice: extend the subsidies or watch premium costs more than double for millions. According to recent analysis, average marketplace premiums would rise from about $888 to $1,904 annually if the credits are not renewed. What does that mean for homeless in America? For people already living without a stable address, without a consistent doctor, without reliable protection from illness. It means even fewer have access to care. It means we risk abandoning some of our most vulnerable in the name of fiscal convenience, and I believe that's unacceptable. The reality is, Homeless in America 2025 will only face greater challenges if these protections disappear. So, what must we do, and how? First, Congress should extend the enhanced premium tax credits immediately and consider making them permanent for lower-income individuals. It's not only the morally right thing to do, but the evidence shows it matters. Without action, some 4.8 million more Americans could become uninsured in 2026. Second, states and local governments must bolster targeted outreach to people experiencing homelessness. Mobile clinics, street teams, trusted community partners. Many people living on the margins simply don't know their options or cannot navigate the enrollment systems. Why should illness become another barrier locking someone into homelessness? Moreover, our communities should invest in preventive care pathways, not just reactive services. If someone without stable housing can access regular checkups or mental health support, we reduce the chance they end up in crisis, and that's both humane and cost-effective. Finally, we must ask ourselves, are we willing to pay the cost later, in emergency rooms, hospital stays, or human lives, just because we delayed the funding now? Because I believe the longer we wait, the more irreparable damage we allow. In short, we must treat healthcare access for the homeless not as an afterthought, but as a central pillar of justice in America. Let's ensure no one is left behind simply because policymakers look the other way. In this climate of uncertainty, especially with the ongoing debates about Affordable Care Act news, and even the stances from former President Trump on this issue, it's time we come together to protect our most vulnerable citizen. Conclusion. In the end, the prospect of letting the ACA tax credit expire sends a sobering message about who we choose to leave behind, and that matters deeply. Recent ACA news shows that premiums could rise by 100% or more, perhaps from an average of $888 to nearly $1,900 a year for those already struggling to afford health insurance in America. Meanwhile, as many as 4 million people could lose coverage entirely if the ACA subsidy cliff 2026 is not addressed. These are real people, many of whom are already in difficult situations, struggling with rising healthcare costs that seem to spiral out of control year after year. If you pause for a moment and consider those numbers, people without jobs, seniors hanging on, the chronically ill, and yes, our friends experiencing homelessness in America 2025, the reality becomes sharper, harder to ignore. These aren't just statistics, they are lives, very real lives, standing at a precipice. And because many of the assistance programs hinge on stability, the steady income, the valid insurance, the dependable care, the disruption of a policy change like this reverberates far beyond a premium increase. It's a real crisis waiting to unfold if the Affordable Care Act ACA is not renewed. With the government shutdown still fresh in our minds and healthcare subsidies hanging by a thread, we must ask ourselves, will those already living on the streets simply be left to fend for themselves when access to life-saving medical care is no longer a given? What message are we sending to those who are already at their breaking point, to those living as homeless in the USA 2025? The failure to act isn't merely policy, it's a choice about what we care enough to protect. We must ask ourselves, is affordable healthcare only available when convenient? Or will we ensure it remains resilient when tested, especially under leaders like Trump, who has made significant moves to roll back parts of the Affordable Care Act? And if not, how many more will we lose? Not just in health, but in hope.